Honorable Dada Ken Lakhani sir, Chairperson, Co-Chairman, and my dear friends. When I think of modern medicine, I think of only one thing. Modern medicine to me is like a soap. When I was in school, you think back about 30 or 40 years, there used to be only one kind of soap, Hammam, Lifebuoy, right? Only one kind of soap. Whether you want to wash your face, wash your hair, wash your body, one soap. But today, there is a soap for your face, for your hand, there is a hand wash, something like that. For hair, there is shampoo. It depends on which kind of hair you want to clean. So, for each and every part of the body, virtually there is a soap. Precisely meant for that particular part, with the belief that every part of the body gets dirty in a different way. So should be clean in a different way. So today I clean my hair. Can you guess it is shampoo or face wash or body soap? So I tried this, you also try. Of course, one day you do it with shampoos, second day you do with the body wash, and third day with the face wash. I think face wash is better, right? So modern medicine has become like this. About 50 years back, 30 years back, there used to be only one doctor. But now there are so many specialists, super specialists, to the extent that for the left eye, there is another specialist, for the right eye, there is another specialist. Even from the in between the eyes, eyeball, there is a super specialist. So it reminds me of a story of an elephant you might have heard in your childhood. Elephant and 7 blind men. So it is the same. Unless you see a person as a whole, you cannot repair, you cannot correct it. Your interpretation will not be correct. So that is the most important thing. We have to understand that each and every part of the body is connected together, integrated together. It cannot be seen as a separate entity. And the moment you try to see it as a separate entity, you can do the treatment, but you cannot cure. So that's why I think always it is called practicing doctor. Practice, not perfect. It is a practice. Have you ever heard practicing engineer? There is no practicing engineer, a perfect engineer, right? But there is a practicing doctor because not sure of what will be the outcome. And to me, among all the profession, doctor is the best profession. Whether you give result or not, you will get your money. Right? Suppose you take your car to the mechanic shop, but he is not able to repair the car. Will you give him money? You will not give him money. Rather, you will ask for some penalty because he has wasted your time and a lot of other things, your misery. But in medical science, in doctors, the good thing for all of us, among at least those who are doctors, they need not to worry about money. That will come, right? And if the patient dies, then it will their next to them, their relative, somebody will give. So here we have to really think about it. What should be the medical science? And I call it table to toilet. Before I start, let me ask a simple question. ये फ्रीज है मेरे ख्याल से. यहाँ हो रहा है, वहाँ नहीं हो रहा. ये तो हो रहा है, उधर नहीं हो रहा. Okay. Can you tell me which are the disease not of the microbes, not of the germs? Which are the disease out of this which is not caused by the germs, not caused by the microbes? Anybody? Anyone? You? Diabetes? Heart disease? Hypertension? Cancer. So we have a clear understanding that which are the disease of microbes and which are not the disease of microbes. So we have categorized disease in two different categories. One is the lifestyle disease, as you said, hypertension, diabetes, cancer, and other is the disease thyroid, another is the disease of germs, microbes, virus, bacteria, tuberculosis, typhoid, malaria, dengue, H1N1. These are the disease of germs. And then there is disease of lifestyle. The problem comes here. The problem comes the moment you are distinguishing the two diseases. So we have to look once again. So at the end of this lecture, I'll ask this question again, and let's see what is your answer, right? Okay. As I told yesterday, your distance between table and toilet, right? Greater is the distance, more is the illness. So whether it's piles or cancer, constipation, ulcer, everything is in between these two. The only thing you have to do is you have to adjust the distance. If you're able to adjust the distance, the disease gets cured. So what should be your distance? That is what is the most important thing. We will try to calculate that. This is what is the most important thing. The moment you eat something, it first goes to the stomach, and that is the first interaction of your body with something which is not your body, which is something outside, which is something foreign to your body. It's the first interaction, the first barrier is your stomach, right? And the stomach decides what should be going inside and what should not be going inside. That is the ultimate barrier between the outside world and the inside world, right? So that is the most important thing. To what extent important? You see, this is the place where the microbes, bacteria lives. How much bacteria? Unlimited. But if you want to quantify it, it is all about 1.4 kg of bacteria. You can, if you collect all the bacteria together and you weigh them, it should be about 1.4, 1.5 kg, equal to the weight of your brain. So your brain weight and the weight of the bacteria is exactly same, almost same. That is why this part is also known as second brain. Many of the function of the stomach can do independently without the interference of the brain. So this thing we have to understand, that you are having two brain, and one of the brain is the one which is the barrier between the outside world and the inside world, and the how important it is, about 1.4 kg of bacteria lying here. Not only here, it is all around your body. It is on the skin. बैक्टीरिया हमारे पूरे बॉडी में है, स्टमक में है, ईसोफेगस में है, स्किन में है पूरे. They are invisible because they are very, very small. But in last 50 years, we have announced war against bacteria. We want to kill all of them. We are made to believe they are our enemy number one. So we try to do all the things so that they are not left alive. And antiseptic cream, antiseptic mouthwash, antibiotic, sanitizer, all those places where the bacteria lives. For that, you have a tool, you have a weapon to kill them. Many of them, millions of them lives in your hand. You want to kill it every day. You do it, right? You are told to do it. Similarly, many of them lives in your mouth. You kill it every day. Many of them live in your on your face, on the skin. You kill it, right? Before you start from your house, you ensure by all the weapon, I will kill all the microbe, all the bacteria. They are the enemy number one, because most of the people, they die, at least 50% of them, not now, about 50 years back, they die of infectious disease, isn't it? Right? So, you see, 1900th century, the 50% of the death, or even more than 50% of the death, was because of the germs, because of tuberculosis, because of smallpox, because of measles, because of diphtheria, right? So because of loose motion connected with, again, microbes. So it was very clear that our enemy number one, which causes 50% of the death or more than 50% of the death, are microbes. So let's kill the enemy, isn't it? And that's what we are trying to achieve. And to achieve that, we have number of tools, we have number of weapons. And these are some of the weapons which we use every day. They are called drugs. They are called medicine. But now it has become a part of the lifestyle. Right? We do not see it as a medicine anymore. We see it as a lifestyle, isn't it? We don't call it as a medicine. You don't say that I'm applying medicine, right? So I'm applying medicine. So rather it is other way around. If somebody is not using sanitizer, then he is unhygienic person, right? It is the other way around. So we don't see it as a medicine, but the truth is these are medicine, these are tools, these are weapons to kill your number one enemy, which is responsible for 50% of the death happening in the world about, say, 100 years back. So what happened? With the help of these weapons, with the help of these tools, we were able to achieve that 50% or more death. Now it is 2010 report I have. From 50%, it came down to 3%. Isn't it good? Wonderful? Logically, right? 50%, you kill all the enemy. Now the human being die of infectious disease, only 3%. Out of every 100 people, the cause of death because of infectious disease is just 3%. So this means modern medicine has achieved something wonderful. And you were criticizing yesterday, making some people angry. Thank you. So today I want to correct it, right? Modern medicine has really contributed. Otherwise, many of us, including me, would have been killed, suffering from tuberculosis or measles or smallpox, right? Maybe already dead. You are alive because you are not killed, because 50% of the cause of illness is taken care by what we call as modern medicine, right? So that is statistically, it is proved, the data is here. I call it a big change, very big change, a dramatic change which happened in a span of, say, 50 years, 50, 60 years, since the time when first antibiotic was invented, penicillin, right? Maybe 1940 or so. But there is one more bigger change. I call it a very big change, but there is one more bigger change which many of you could not see. And the bigger change is the human nowadays became bigger and taller. You see, for most of you, including me, we are taller than our parents. We are bigger than our parents. Maybe more beautiful than our parents. Right? That is something where we can debate. But surely we are taller than our parents. We are bigger than our parents. Isn't it? Right? So that is a contribution of antibiotics. I will prove it later on. Whether human being or animals, when they are put on antibiotics, any kind of antibiotics, they start growing very, very big, very, very quickly. That's why the animals who are grown to be killed so that it becomes your food, they are grown with a lot of antibiotics, because then they will grow very, very fast, very, very big, and then they will be more money. It will translate into more money, right? So one more good thing is, you want to be bigger, taller, or you want to remain shorter? Everybody would like to be taller and bigger, isn't it? And this means antibiotics or those medicine are contributing silently in one more thing, making you taller, making you bigger, right? So there is a reference also. But it's like, you see tomato, which is grown, homegrown tomato in a village, looks little bit ugly, very, very small, but then genetically modified tomato. Looks like coming from the factory, all evenly shaped, all very big. So nowadays, the human being, should we compare the human being with this tomato, or they have become this? Right? So if you see, go to any modern developed country, most of the people will be compared to this, bigger, taller, right, like that. So that is how they will look. But one more thing I'll add, human now became bigger and taller and also sicker. More sick than before, no doubt about it. Because now most part of the life, for most of the people, we are consuming some kind of medication, and for most part of the life, for most people, we are under some kind of pain on a continuous basis. Some kind of pain, right? So continuously, if you are dependent on some medication every day, so you are not living. You are trying to live, right? So you are not healthy. So that is one thing, that today's humans are bigger and taller but sicker. Sick than what it was before. So why all this happening? What the study says? It's all about studies. It is all about proof. So the mechanism, how the body works inside, what causes these changes, if you understand the cause, then only you can find the cure. Then only you can find the solution. To find the solution of a problem, first thing is we have to find what causes this problem at the first place. Unless you know what is the solution, what is the problem, what is the cause, why it happened, you cannot go for the solution. So the cause, let's go back. It starts with what we call as antibiotic resistance. It is a very simple concept. Let me make you understand in a very simple way. I'll give you one example to make you understand. Classical example is example of one bacteria called Helicobacter H. pylori bacteria. H. pylori will call by name. It is seen in 1980 that more and more people were suffering from ulcer. And if you suffer from ulcer even today for long period, ulcer gets converted into cancer. So people are suffering from ulcer, not getting cured, and then getting converted into cancer. One thing commonly found in all the people who were suffering from ulcer was they all were having one bacteria in common, H. pylori bacteria. Anybody who will suffer from ulcer, in their body, in their stomach, lot of H. pylori bacteria. Then the science invented an antibiotic, means a tool to kill that H. pylori. And they saw when they kill H. pylori bacteria in the people who are suffering from ulcer, the ulcer goes away. So they got a cure, a medicine to treat ulcer. Clear? So this means you see 10 people suffering from ulcer, and then see what is common among them, and you try to eliminate that common thing. And if the ulcer goes, this means the cause is, what is the cause in this case? H. pylori, right? So you know the cause, you remove the cause. If it is cured, then it is more, now you are sure about it, the cause of ulcer was H. pylori. What is the underlying mechanism? That is not important, that people are not interested. Most of the time, even science could not find. But more important here is that if I could do something to remove ulcer, that is the first duty of science, or what we call as modern medicine. So that was achieved. So how it happens? Imagine in a stomach of a person with a ulcer, these are yellow dots are H. pylori bacteria. Now, if it is getting killed, then the ulcer will also vanish. That is being proven. To kill it, you have to give some antibiotic, which can attack, which can kill this bacteria. Here, very important thing you have to understand, the total number of bacteria in the stomach is constant. Neither it can grow more, neither it can grow less. The total population in the stomach is constant, right? Let's say it is 1.4 kg of bacteria. That is constant. Now, when the antibiotic is killing this H. pylori bacteria, the ulcer is gone, surely, but the population of total bacteria will reduce or increase? Reduce. But the nature of the body is it has to remain constant. Even if it gets reduced, some other kind of bacteria will multiply quickly so that the total number, total quantity should become same, right? So the kind of bacteria which will get an opportunity to grow very quickly are the kind which cannot be killed by that antibiotic. Is it logical? Yeah? So those bacteria, those are known as resistant bacteria. They are already there, but in a very small quantity in the stomach, right? So small quantity that it cannot influence your body at all. It cannot do any good, it cannot do any bad, it is just a minority resident in your body, right? But now, when the antibiotic killed the H. pylori in this case, then the minority which cannot be killed by that particular antibiotic, what it will happen? It will get an opportunity, a playground to increase very quickly. And how much time it takes? 1 day. 1 day, right? In 1 day, they can cross 300 generations. For us, 1 generation means 30 years. For them, in 1 day, 300 generations, right? So 1 day is enough, and within 1 day, what will happen? Your stomach looking like this with ulcer, antibiotic comes in, ulcer is gone, but now your stomach look like this, right? These red are resistant bacteria. Resistant means they cannot be attacked. They are immune to antibiotic, number one. And most likely these are the bacteria which are notorious also. Somehow they are notorious also. They are not contributing any good to your body. But when they are in large quantity, it is going to be a burden on the body. Because the total amount of bacteria cannot be more or less, it has to be constant. This means they are occupying a space, but they are not contributing in your well-being, right? So that is one example. Now, if you start taking the antibiotic more and more, this means your body, your stomach will develop more and more bacteria which are resistant to the antibiotics, right?